All right, good afternoon, everybody. I'd like to call this meeting of the Rutherford County Benefits and Insurance Committee to order. Like our first item on the agenda is approval of the minutes, but let me make a little statement on that. Y'all have got a corrected copy on the top of your stacks. That was from the last meeting. Mr. Russell arrived after attendance was taken, so we wanted to note and get him put on the list. So what we were mailed didn't have Mr. Russell in attendance, but he was here. So we've got him on that. And now I'll take a motion to approve the minutes, please. Ms. Barnes, do I have a second? And got a second on that. All those in favor, say aye. All those opposed, motion passes. All right, our next item is going to be financials, and we'll get Miss Melissa Stinson to give us an update on that, please, ma'am.
All right, here we
Push the button. Hold that one down.
Now is it on?
Yes.
Thank you. Okay. It's new. Nobody told me that. Sorry. Okay. So if we look at the month of September, for the month of September, our per employee per month is at $817.46. That is compared to prior year, which was at $621.69. We are seeing an increase in the number of claims below $200,000. We've seen a significant increase in the number of events, so that's driving our cost upwards this year. When we add our on-site medical fees for the month of September, our total per employee per month goes to $835.21 compared to prior year, which was at $652.84. We also have a little bit of a discrepancy in the number this year, or a variance, because September 1 was the first day of our new on-site medical clinic. So there is a reduction in the number of visits that we've seen as we've tried to get individuals reestablished into the new management company of the clinics. So whereas we were seeing around 1,600 appointments, we only saw 732 during the month of September. Now, one of the things that I did review for the month of September as part of the transition and part of my annual meeting with Cigna is what is our clinics trending in proportion to the private healthcare community. And as of the month of September, if you will look at the year-to-date average, we are at a cost per visit of $87.15. On prior year, we ended up at a cost per visit at the clinics of $88.57. In the private community, through our Cigna records, we are at $110 per appointment. So there's not a lot of delta between what we're seeing in the private community and what our costs are in the clinics. And you have to remember that on the $110, that's not in consideration of the $20 copay that we would have. Or any other offsets, deductibles, and things of that nature as well. So we're trending very similarly in the private, just using our regular Cigna insurance versus the cost that we're seeing in the clinic. So it's going to be important that we continue to monitor this over the next 3 years during the course of our contract to make future decisions about the clinics. We have ended on a year-to-date average of $914.97 as of the end of September, and our total average for the prior fiscal year was $745.57. Year-to-date was $754.67, so we're actually 21.2% above cost at the end of September over prior year. Are there any questions?
I'd have one. The amount that we pay for the clinic, do we pay a flat rate per month for that clinic, whether they see one person or 100 people, or is it based on how many people they see that month?
It's a little bit of both. So we have personnel fees that are established that we pay, just like we did with care here. The same is true today. So you have personnel expense, and then you'll have ancillary costs such as supplies, labs, pharmaceuticals. And the supplies, labs, and pharmaceuticals can vary month to month. Personnel usually remains stable though.
Questions or statements or comments? All right, Mr. Hall.
I was just curious, last month, or our last previous meeting, is it correct we were trending at -4%, and now we've jumped to 21%?
Yes, that's correct. We had, and I apologize, I didn't bring it, but we've had, since the beginning of this fiscal year in July, we've had one claim in the first 3 months that's exceeded $500,000. We've had a couple of claims that have exceeded over $100,000. Our trend is already higher in that regard than it was for the entire year last year. And so I recently had the review of Cigna that I indicated, and we are seeing a significant growth in those $100,000, $200,000 claims over what we've seen. We have a high prevalence of cancers in our population. The information that I received showed me that we have a population that's not obtaining their regular physicals, such as mammograms and pap smears, at the level that they should, so our early detection rate is lower. And I'm going to be working to address some of these things now that I've been given this information. I'm looking at maybe a mobile unit and things like that to help increase the preventative services that our people are lacking currently. Yes, that's correct.
Anybody else have anything else on our financials? All right. Yes, we'll do the work injury financials now.
So if you refer to Fund 266, we'll take a look at that. Through the month of September, we're at $155,428.25 year to date. That's compared to $157,074.49. So we're almost trending the same from current year to prior as of the end of September. I know Mr. Good will provide more details about our September experience during his report.
Anybody have anything on our the financials from Ms. Stinson on the work injuries? Having none of that, then we'll call on Mr. Dan Good to come and give us his OJI report, please, sir.
Good afternoon. You should have your report there in front of you. You'll notice that in the month of September we had 23 injuries requiring medical attention. You'll see the causes of that as the breakout. The year-to-date, we've had 186. Of those 186 injuries, 125 of them were recordable under OSHA. 62 of those claims had restricted days, 20 had lost claim days, and there were 43 others. On the next page, you can see where we are this year compared to the two previous years. And to break out those injuries for you today, of the 23, we've had a total incurred dollars of $41,490 at this time. Of the 23 injuries, 13 of them were with the Board of Education, and they had total incurred dollars of $30,565. The Highway Department had one injury for incurred dollars of $900, and the County General had 9. And the total dollars incurred for the County General was $10,025. And then lastly, on that last page, as you look at it, you'll see the breakout of the County General injuries for their 9.
Anybody have any questions for Mr. Good on his report for our OJI? Mr. Dan, appreciate that.
Thank you.
Okay, the next item is going to be our wellness update, and we'll call on Ms. Kelly to come up and give us a report, please.
Good afternoon. The Rutherford County EMS Department sponsored our CPR and AED training free to any county employee. We had 18 in attendance that got their certification. We had a stress management wellness seminar at Community Care with 15 members of Community Care employees that attended. we had a cooking class at the health department that was taught by a registered dietitian, healthy cooking for diabetes with 12 people. We recently had our employee appreciation health fair on 10/15 at Lane-Agger Park. We gave 420 flu shots were administered that day. We also did a new contest this time. If you got at least 5 medical screenings done at the event, then you could register for an Xbox and a Kinect system. We had at least 118 employees get at least 5 medical screenings, and Linda Hyde was our winner for the Xbox Kinect system. Amy Davis won our grand prize, which was a year membership to YMCA. The exercise program that we have going on is our walking program. It was an 8-week program that we worked together with UT Extension Office, and we've had 106 people participate with us with 14 teams. Our grand finale is this Sunday. We're going to meet at the American Heart Association Heart Walk at MTMC at 3 o'clock, and would love to have any of you participate. It's a community-wide event, and we'll announce the winners of our walking program there. The next thing that we have coming up in November is 5 Ways to Wellness, a lunch and learn at the health department. Anybody have any questions? Thank you.
Okay, the next item on the agenda is going to be update on our clinics.
The first phases from a financial perspective on the transition of the clinics was the implementation cost. I had provided Budget and Finance with an update on implementation. I wanted to do the same for the Insurance and Benefits Committee as well. We had a total approval on the implementation as part of the award of contract of $201,714. The clinics have come in at $178,986, which is 11% below the projected cost. We may see additional cost be credited back towards the implementation as we're doing a final sweep to make sure that equipment that was ordered is actually being utilized based on the needs of our population, and there may be some returns that would be a credit. But nonetheless, I was very pleased that we came in below budget, and I wanted to share that with you. In addition, I had provided some other information to Budget and Finance I wanted to share as well. One of the I've reported a couple of times about a wellness survey that was done at the end of 2010 and the availability of appointments being one of the #1 complaints by individuals. And I wanted to share some statistics with you all that I had gathered. Our clinics operate 138 hours one week, 143 the next. The reason there's the difference is because our health department operates a half a day on one Friday and a full day the next Friday, so we see that difference. There are 12,724 participants eligible to use our clinics. So we have over 12,000 people competing for 140 hours average a week to use those clinics. We have a supply and demand problem. That's one of our issues on why people can't get appointments. The other is the no-shows into our clinics, which we'll address a little bit later as part of the meeting today. The other issue that we have is that 67% of all of our participants, assuming that all dependents live with the employee, reside in a Murfreesboro zip code. And inside of Murfreesboro, we have Blackman Clinic, and then we have the health department, which I referenced earlier, which the health department's on a pretty limited schedule throughout the week, even with the every other Friday. Smyrna represents the second largest pool of our population at 14.6, and then Laverne is 14.3. Everybody else is somewhere in the county at 14% or elsewhere. So we have the supply and demand problem, which I referenced earlier. The other thing is that we have a high occurrence of repeat visitors to the clinic. In the month of September, 24% of all appointments held were held by somebody that had already been there once that month, which is okay. That's what the clinics are there for, but I think that it's important information in terms of understanding why are there not appointments available for somebody that needs it today because they've woke up not feeling well. We have a high occurrence of repeat individuals, and we are treating a lot of chronic conditions in our clinics, and those appointments book out into the future. So it is difficult to have a child or yourself wake up feeling ill and actually get into the clinics. The other is the level of care that's being offered at the clinics. We are looking to see, what was the level of care intended to be based on the contract that was awarded with Care Here? What had the level of care became? What is it today, and where do we need to make modifications? Transitions are never perfect, and they're never easy, especially in the scale in which we transitioned. We have 5 clinics. On the first day of September, we opened up 4 of them. That's a tremendous undertaking. And so as we continue to kind of pour through the concerns that we're hearing and address some of the transitional items, and we hope to see some improvements in terms of employee satisfaction with the clinics, availability of appointments, and some of the other issues that we've seen both with Care Here and currently with Take Care as the management company.
Thank you very much for that update. So it's good to see the clinics coming in, getting them implemented under having a little savings on that. All right. Anybody have any questions on the? Yes, Ms. Harvey.
I just want to ask a couple of questions, please. You were talking about the demand is so much, and we have limited facilities here in Murfreesboro. What do you see in the future of opening possibly more clinics available in the city close by, so we can get that 67% to have more time in clinics?
You've asked 2 very timely questions today, and they weren't plants, but I do appreciate them. On that particular question, I've already asked Take Care to give me a cost analysis for expanding the hours at our Stewart's Creek location. That would be the most logical place to start. Is because it doesn't operate as many hours as Blackman. Blackman is maxed out. We run between 6:30 and 7 in the morning to 6 or 6:30 at night, and we're open on Saturdays at that clinic. So we have hours we could expand at Stewart's Creek. We have hours we could expand at Walter Hill. We are also looking at a location for potential transition to the health department. But that will take funding, and I am in the very infancy phase of seeing what would it take to flip an existing location into the clinic. So I think the logical place is to start with what we already have and expand it out. Knowing that, and one of the things that I didn't mention earlier that I had mentioned to Budget and Finance is people want to be treated when they want to be treated, where they want to be treated. The demand on our clinics are far exceeding, I can't exaggerate that enough, the expectations of what people have of a private practice. We call a doctor's office. We know that there's a pretty good chance I'm not going to get worked in today. I mean, that's just, they're booked. And we accept that and we find an alternative for it, right? If that happens at the clinic, my phone rings all day long, quite frankly, where I take calls of, why do we have these clinics if I can't be sick and get in today? The expectations are higher. The same is true for other things at the clinic. So people, I get complaints about, I don't want to drive to Stewart's Creek. I don't want to drive to Walter Hill. At some point, we as the county have to say, this is a tremendous benefit to our employees. And it is exactly that. It is a benefit. It is not a requirement of Rutherford County to offer this. It is a benefit to you as an employee. And you have to make personal decisions about your health care, just like you do in the private community. You may go to Dr. So-and-so for 50 years and walk in and he make you mad and you switch doctors. You have to decide, is it worth my $20 copay to drive from Blackman to Stewart's Creek, or do I want to pay $20? That personal decision at some point does not become the problem of Rutherford County as your employer, but the expectations are sitting there right now. So we have some behavior modification that we need to do, and we need to expand the hours where there is existing space with the resources that we have, and then look to see, is it worth for the convenience for our employees to pay to flip a location simply for their convenience whenever they could drive 10 miles down the road and get it for free. So those are some of the analysis that I'm doing in the background right now.
And one more question. You said that we opened 4 out of 5 clinics, I believe you said when we opened up. Was one of those part of the walk-in clinic that was at the Smyrna area?
The health department was not open that day because the first was on a Thursday, or otherwise we would have started all 5.
So is the walk-in clinic that's in the Smyrna area, is that up and running?
The walk-in clinic is actually Stewart's Creek Clinic, and we have not had walk-in hours. We've had work-in hours. We will re-implement walk-in hours, which I communicated in an email maybe a month ago, starting on November the 1st. And it will be 7 to 9 in the morning, if I recall. Is that right? Okay.
Refresh my memory for me. Can this new system keep someone from duplicating appointments or making 2 appointments? You know, before I think we talked about with Care Here, they couldn't make 2 appointments within a period of time because some people were making multiple. Do we still have an option to block that to keep people from making so many and holding those slots?
They would be able to make 2 appointments right now, but here's the difference. With Care Here, and this was one of the things that I pushed during the RFP process and the interview process, is we did not have the 2 receptionists like what we have right now. One sits at Stewart's Creek, one sits at Blackman. So we have gained some efficiencies. They are scrubbing that system before. One of the complaints the day before, so they would modify it out if they had double booked. One of the complaints that we had as an example under our 2010 survey was there's a free form box. I tell them I'm coming for this. I go over there. They don't have my medication. We actually have somebody that looks a day in advance for just like at a private practice, who's coming in tomorrow, let's pull these files. They call them, they give them a reminder of their appointment, they modify the calendar if they say, oh, you know what, this is Melissa Stinson, she comes in here every month for her labs and she's booked out a 45-minute appointment. That's not correct. I'm going to book her down to 15 minutes. So we are doing that work in the background.
I know that we now have expanded time for appointments depending on what your need is. Do you think that has made a difference in the number of people that are able to be served, having expanded time?
So if you log into the online schedule right now, currently it's blocked every hour, is what Ms. Barnes is referring to. If you log into the online schedule right now, it will require you to schedule an hour appointment. They will manually modify the calendar on the background. Majority of our people are actually calling instead of using the online portal currently. It is something that Take Care has been charged with fixing. That it's been almost 60 days. It's time to change that. We've probably had our surge of established people that are going to flood the system. Everybody else will probably trickle in. So they will be modifying that, and you'll see that a little bit different.
Anybody else have any questions on the clinics, on that part, the updates of the clinics? And yes, Mr. Hall.
I was just going to ask, when you're talking about how much it cost earlier, when you're talking about now that the price of the clinic has crept up to about $88 or $85 or whatever, and then we're paying about $110 if you go to your regular doctor and see them. What I was thinking about was back when we implemented this, it was really a few reasons why we got those clinics involved. First thing was to have a healthier workforce and to be able for people to get chronic care and stuff like that, catch heart symptoms and diabetes and stuff like that before it came out, and hopefully would save us money down the road. And apparently we've got a lot of folks in the community in our workforce that do that, but there's some that's not, since now that if the price is creeping up to where it wouldn't matter whether it's whether we have it at Care Here or whether they go to their own doctor, if the price eventually becomes the same, and with that 21% going up just like that, I mean, at some point they're going to meet to where it's going to be, if we keep it, it's really just because it's a benefit to our employees and stuff. And I really want them to understand, to think about it, because I know a lot of employees came on since we implemented this, and the main point of it, putting it on, was being able to help our workforce be healthier and lead healthier lives, and then also to save the county money as far as having days gone off work and stuff like that, and then lower expenses. So I hope that they understand that and know that it's not just a finances all the time, but at some point it will become finances, to where you look at it, and if it's a big loser and our workforce is not any healthier for it, then somebody would eventually make the decision that why are we even doing it? So I think right now, and that's stuff that I know you look at every day and make those decisions and stuff. But I remember whenever we implemented, I called the company in Arkansas that was using Care Here. Their cost, they were running at about 18 to 22% going up each year. They 2 years later, they were at 9.5% increase in their healthcare costs. Not insurance, what they were paying for actual, products that they were purchasing from hospitals or the doctors or whatever. So that's our goal, is to put the trend down and make everybody more healthy. But it is, like you said, it's just a benefit.
If I could just add one comment to that. It's transitional. Change is hard for people. It's hard for me. I mean, that's the nature of human beings. I am still a believer that if we allow the new, it's different. It's night and day from what we've had to what we have today, and I fully admit that. But I am still convinced that if we allow the process to work the way it's designed, that we will see more savings. And I'll give you one example that is a hot point in our employee population right now. Someone is on a medication that they're under the care of a specialist for. With Care Here, you could actually make an appointment, 20-minute appointment. You could go in and say, my heart doctor has me on ABC. And if it was a generic, that's all we stock in the clinics, they would give you those medications. Now, the selling point was we can get these medications in bulk, and therefore it's cheaper to the county. Well, I'm not a firm believer of that, because nobody ever talked about the labor charge associated with that 20-minute block of time for that person to come into the clinic to get their medications for free, so they didn't have to pay their generic co-insurance amount, which is probably never more than, most average $4 to $5, and probably never, not often more than 10. So the county was incurring, for 2010, our labor charge per appointment was $34.72. So we were incurring $34.72 in cost for that employee to come in the door, to bring a prescription to them, to get a prescription refilled at the clinic versus going to the pharmacy and paying their co-insurance. And a lot of people were doing it. And that's not the employee's fault, but it is something that we are starting to redirect care to where it should be. If you're under a specialist, and a specialist is prescribing that care, that's who needs to have management control of your treatment. Otherwise, if one of the things that I would hear in the private community was, the reason I don't like these on-site clinics is because an employee goes to the clinic and the practitioners there will change their medications, and I never get notice in my private practice. Then they come back to me, they've adjusted their medicine, I want them on something else, and ultimately those type of things cost us more money. So anyway, there is a multitude of ways that these clinics need to be dissected and the costs need to be analyzed, and I am chiseling away at the rock as fast as I can. So,
questions? The next thing we'll address is the no-show charge. Ms. Stinson?
Okay, I've got two sheets for you there. I've got one budget minutes, and I have one that's just kind of a timeline of no-show fees. If you will go to the second page, I only printed off the relevant pages. It was like a 15-page document. Right before where it says endowment grant contract, the very last paragraph there shows you what the Budget and Finance Committee had approved for no-show. They had approved last October reducing the fee to $15, beginning to charge with the first missed appointment versus having a grace of an appointment, which had been done previously. And then I had a 1-year approval on the no-show fee, and it was to be revisited, which is why it's on the agenda today. If you'll pull the timeline of no-show fees, there's two pieces of information that you'll need for discussion today. Our labor cost, as I commented on earlier, for 2010 was $34.72 per appointment. You'll need to write this. $34.72 per appointment in 2010. And in 2011, looking at the first 8 months, I didn't include September because of the variance, we're at $36.32. We adopted a no-show fee of $25 beginning with the second missed appointment on January the 1st, 2010. The original resolution that was adopted said that they must give a 24-hour notice. Now, I began with the county in June of 2010, and at the time that I joined, they could cancel up to the time of the appointment. I don't know that the 24 hours was ever invoked, quite frankly. Last fall, we passed a resolution to be effective on January 1st, 2011 that removed the one visit grace, but it dropped the fee to $15. And the reason we did that is because over 80% of all missed appointments, people were only missing that one appointment during the year. So we wanted to incentivize them to not have a second occurrence. For the first 8 months of the year, as an example, we've had 3 individuals in the county that's missed 5 times. Now, 3 out of our population is not large, but we continue to see our no-show occurrence at over 80%, just as we did whenever it was at $25 with the one grace. So for this current year, for the first 8 months, we've had 466 missed appointments. 466 times our current labor rate of $36.32 is a relatively large number. And that's 466 appointments of people who woke up sick in the morning that couldn't get an appointment because all of the appointments were full. So there's 2 points of discussion today that I've brought for the committee. One is, what is a fair period of notice? Currently, what happens is they will get an email if they use the online portal, just as they did with Care Here, a reminder notice in your email. You got an appointment coming up. It's at least 48 hours in advance you get that notice. The day prior, the receptionists at the clinics are calling, just like at a private practice, and saying, Miss Stinson, you have an appointment scheduled for 3 o'clock tomorrow, or whoever it is. So what do we want to do in terms of cancellation notice? Is it acceptable to us that they cancel up till the time of the appointment? Because one of the things that we do now that we didn't do before is we maintain a wait list. So if you call and say, I'm sick, then they will say, I don't have anything available. If you'd like to put your name on the list, I'll be glad to call you if something cancels. And I know that they're doing it. I've heard it from people, so I know the process works. But if they get notice 5 minutes ahead of time, there's no opportunity for them to do that. So that's one point of discussion I'd like to have with the committee, and the other is what fee do we charge? I know it was suggested to charge the full fee when it was reviewed last year, and I'm coming to the committee to look for recommendations on what you think we should do in that regard.
All right.
You may have said it and I missed it. What have our numbers done in the last year when we went from allowing one to being charged on the first one? 460 this year. What was that number a year ago? Is it trending better or getting worse? Or
It's only down slightly. It was down like 9%.
so $15 hasn't made believers of
Right.
anybody.
So we were at through August in 2010, we were at 510. Through August in 2011, we're at 466.
That $15 is taken out of payroll.
Correct.
Questions or discussion? Ms. Sonia, and then we'll get Mr. Gray.
If the administrative cost is $36.32, and I realize I don't have a vote on this, but if that's the cost for the cost for it, why not raise it to $36 if they miss the appointment and do like the doctor's office? Because the doctor's office says if you don't cancel within 24 hours, you're going to pay for that appointment, here or not. So you're not going to get the care and you're going to get the cost. So if dropping it to 15 didn't encourage anyone to maintain their appointment, why not put it to the actual cost of what it costs to hold that appointment to the $36? I'm just asking.
Mr. Gregg, have you got a comment?
I was just going to ask, I was trying to think to my dentist who charged me, I think $40 when I didn't show, and I was thinking, what in the private sector, whenever you miss a doctor's appointment, isn't it $40 to $100, something like that, depending on whether it's a doctor's appointment or a dentist, something like that?
Typically, I see 25 to 50 being charged. He had you on the high end, that's right.
I agree with her, though. The $36 sounds like, I think that would get your attention, yeah.
The 36, I just want to, it's only the labor. It's only the labor cost associated.
Okay, Ms. Stenson, make sure I understand. Right now, we allow a cancellation up to the time of appointment.
Yes, that's correct.
$15 charge.
Yes, that's
for missed.
correct.
Okay. By letting them cancel up to the time of the appointment, because we're not serving the needs of anybody else out there that needs an appointment. So I do think we need to look at the period of time, because that just makes sense. That we make a correction there. And I don't remember why we changed it. I'm sorry, can you say it again? Way back when, did we just have discussion here? It was brought up to the committee, because at one time it was 24, and then we went to no time?
I don't know the history. That's why I said, you know, when I came in June, you could charge up to you could cancel up to the time.
I have a question or a statement, and then we'll get to you, Mr. Jeff. Do we have a way of implementing you didn't call before 24 hours? Because I know with the other clinic, we had a hard time of blocking 2 appointments and things, because we were a stickler on the 24-hour cancellation thing. So with this new clinic, do we have the means of, I know we have a lady looking at it and going over it the next night, so do we have a means of when she sits down and looks at her list before she goes home that evening, if we didn't call, to go ahead and charge, or is there a way to do that with this clinic?
There is a way to do it. What I would recommend, because what will happen is this: people will say, my appointment is at 9, I called at 9:01 the day prior. Yeah, we don't want to get in those type of, that's not healthy for anybody. I would prefer it be that the appointment has to be canceled by 7 a.m. the following morning, because that's when our clinic's open. That limits our risk. They can leave a voicemail, they can cancel online, but as long as there is a message from them prior to 7 a.m. on the day of their appointment, then the fee is waived. Because then the only risk that runs for us is that 7 a.m. cancels, and we don't find out till 7 a.m. But that still is far better than 466 that they either don't call or, cancel in a time that we can't rebook.
Paula, do you have anything else before we go?
For a number, if they have a message and they have to cancel by 7, is there a phone number they can call as opposed to going online and making that cancellation?
Yes, it's our clinic number.
Will somebody be available to respond to that call?
There's a voicemail.
Tanya.
I think what happened with our prior provider was that they didn't have the technology to drop those appointments. That's why, the 24 hours was put in there, but they didn't have the technology to go back in, if I remember correctly, and I may be wrong, and that's why it ended up where people were just, if you just let us know that day, that we can handle it. And I think that's what's happened. The only thing that scares me about the phone message is, as opposed to written notice of some sort, is that old thing, well, I called, you must have just not got it. And that doesn't really protect us from that, does it? Is there any way, are we saving these recorded messages so that if somebody says, well, I didn't get it, well, here's the, we got messages at 9:01 and 9:02, you've saved those if there's an issue. Otherwise, is that really going to help us?
We don't save the tapes. I mean, we would have quite a large accumulation of tapes if we did that, but it's really no different than before. I mean, before, people would say I called and there was no documentation of it. They weren't recorded phone calls. They did have someone that would answer their calls at later hours than what our lines are answered because they used a call center in Texas. But they weren't recorded calls that I'm aware of. So, that's just one more reason why to use the portal. Just put a plug in for the portal. To use the online scheduling versus calling is because then you've got a clear record that you went online and you canceled your appointment. But anytime somebody brings a concern about it, we always research it. We'll go back to the vendor and ask them to research the issue and see what their records show us.
But if you have a lab appointment, right now you cannot schedule a lab appointment online. So if you have a lab appointment, will that show up on the portal that you even have an appointment to go into cancel?
Not if you haven't established a profile.
But if you have established a profile, it will show that you have a lab appointment. It called in, scheduled.
Yes, that's correct. It does feedback through the portal if you schedule.
More discussion or questions, or what's the... Yes, Mr. Jeff.
From citing the numbers of no-shows, the change from not charging for the first no-show to charging for the first does not appear to have reduced the number of no-shows.
No,
is it worth going back to the old?
To the old and
not charge for the first no-show.
So then stay in the same position we're in today? Is that what? That's a...
Well, and combine that with the 7 a.m. cancellation time frame you mentioned.
Okay, just so that I understand, your recommendation is that we go back to the method of allowing one grace period, requiring that they give a 24-hour notice.
Just for discussion. No, requiring the 7 a.m. notice.
Okay, so we would give them the one grace period, start charging $25 at the second visit, and then the condition to not get charged is that you call prior to 7 a.m. on the day of your appointment. Is that, I just want to make sure I understand it.
Right, and just asking, do you think the 7 a.m. would fix our problem if we kept $15 from the first visit?
No, I think most people don't call at all. They just don't show up. I mean, that's the feedback that I have gotten.
I'm going to disagree with the grace period. I mean, that's just encouraging people not to be adults and take care of their business. I mean, it's a benefit we provide. You said that yourself a minute ago. People ought to be courteous enough to follow through if they're not going to be there. And I believe we just got to get a little more painful. I mean, $15 isn't hurting enough. And I hate to say it, but I don't think we can get it passed to the full commission and go all the way to the $35 or $34.72, whatever it is. But I believe we could change it to the 7 o'clock in the morning. They're leaving a voicemail to cancel now up to the time of the appointment. It's just changing what time. I believe we could change it to the day of cancellation and $25, and that would possibly get through the political gamut and would also free up staff to rebook those appointments, because it's ridiculous for somebody to call at 9:59 and cancel a 10 o'clock appointment. That provider just standing there twiddling their thumbs. Realistically, they're not. They're backed up probably anyway, but that boxes one person out, and that would be what I would rather. I would rather see us change it to day of cancellation and $25 with no grace period.
Okay, so
I'll make a motion at that point.
All right, Mr. Will has made us a motion. Do we have a second on that? And the motion, let me make sure I've got it right, is $25 cost with no grace period, and it's on the first missed appointment. Oh, and cancel
by
before.
7 a.m. day of appointment.
All right, sorry about that. Thank you. Do I have a second? And Mr. Donnie Hester seconded that motion. All right, and it's open for discussion now. Harvey.
Do we still have the opportunity, if we know that we're going to be running late, say I'm going to be my 10 o'clock appointment, and I know I'm going to get there at 10:05, are we still allowing people to come in 5 or 10 minutes late? Because in the past, if you had a 20-minute appointment, as long as you got there within that first 10 minutes, you still had your appointment. Is that still the case?
You are correct. Before September 1, you had a 10-minute grace period. So if you arrived after 10 minutes on your appointment time, you had to reschedule. The current period is 15 minutes. They have built in a 15-minute window. So if you arrive more than 15 minutes late for your appointment, you have to reschedule.
Would you be charged as missing an appointment if you got there 15 minutes late?
If you got there more than 15 minutes late, you will be charged a no-show fee.
Related to that, but I'm a little bit concerned because we don't have more people using the online feature for making appointments, because I believe that was done with everyone in our previous provider, correct? And now I know it's the transition and changing over. Do you have any ideas of what we can do to help increase that usage now and move away from the phone?
If I recall, I think we were like at a 60-40 split, even with the old provider. 60% online and 40% were calling, because I had asked that question during. Yes, I am very eager to increase the online scheduling system, because this system is not like what we've had before. Before, it was a warehouse where you could print off your HRA results, you could print off your office visits, and you could schedule. This current system has much more functionality. You can view labs online, you can schedule appointments online, you can secure message with the provider online, you can request a refill online. So there are certain things that you can do that we couldn't do before that we're missing the opportunity on if we don't use the portal.
And Miss Lisa, you've been waiting patiently with me.
Now, I just had a question, Melissa, on those missed appointments. How many of them were repeat offenders?
Meaning that they had...
Yeah, would it be 466 separate individuals, or was it...
Well, we know we had 3 people miss 5 times.
Yeah, so this is the way that I had asked that we go in and look at just from a payroll deduction. So we wrote it up to the employee. It could be the employee, their dependent, whatever. But this is how many deductions did we take out of a payroll for our employees. So we had 295 employees that received one deduction year to date out of their payroll. Okay. We had 51 people who had 2 deductions taken out. And on down the line, we had 10 that had 3. So it could be me, my spouse, and my child that accumulated those 3. We only looked at it on the employee level.
One more question. If we pass this today, when would this go into effect? Do we have any idea?
We had a 1-year approval on the current $15, so it would change January 1 of 2012. And that's a good question. Thank you.
Just for a little information, I run some numbers. The 466 appointments at the cost of $36.32 is $16,925.12, and we're only going to charge them $15, or been charging them $15. That's only $6,990. So there's $10,000 we lost. Now, we're not in it to make money, but there's $10,000 there, basically, that it costs the county more than it costs the employee. But what we got to get across to the employees is that $10,000 gets tacked on our per employee per month figure that was $800 and something. And if my premiums and matching that I pay and the county pays for me, if it don't cover that, then that means somebody's premium's going to go up, and it'll probably be my part and not the county's part. So something we need to remember when we put these charges on, that it ultimately affects us because we break it down every month per employee per month, and it has to match. I'm very simple in that I do the payroll, I have a match and the county pays for me, I have my premium, and it together, if it does not cover the $800 and something, we're going to have to make some changes to the premiums. So when we put this out there and present it to the board and then present it to our employees, we're going to have to take a little hit as to not take a big hit down the road. That's just my thinking, and that's kind of the way I've hoped we've tried to lead in doing things here, to take a little, save a little, as to not cost a whole lot later. So we still do have the motion on the floor. Is there any more discussion on sending the, oh, I'm sorry.
When the phone call is made to the employee to remind them of the appointment, it's usually a recorded message?
No, it's the actual receptionist calling.
My thought was, can you be sure to say if you don't cancel by 7 a.m., you will be charged?
I will make the request that they add that. Now, I will play devil's advocate on this. So when you know, we're talking about human beings calling, and if they forget to say, and we charge, that will not be viewed as a condition of waiving the fee, because that would be a natural defense for them to say is, well, they didn't tell me I had to cancel. So we'll publish it. We'll put it on our, you know, everywhere that we can in documented fashion. We'll post it at our clinics, but the onus will be on the employee.
Under our current program, are any of our clinics open later than the receptionist is there to take a message?
No, there's a receptionist there until 6 or 6:30, depending upon what time Blackman closes. So as long as our clinics are open, there's a live person there.
Okay. I just want them calling prior to their appointment is the key. Waiting till after the clinics are closed and saying, I'm sorry, I missed my appointment, is not acceptable, right?
Correct.
Joe.
I look at numbers, not people, honestly, yeah. I mean, majority of our people that work for the Board of Education just because they represent the largest population of our pool of people. But as far as diving in the details of who it is, I don't really look at it from that perspective.
More discussion on the motion? All right, hearing none.
I just want to ask one question. I'm
Yes,
sorry.
ma'am.
You made the comment we'll have to work around that. I just want to explain for the committee the way the process works, okay? We get a list. We send it over to finance. Finance deducts it out of payroll. We don't discriminate. We don't pick and choose. If you don't cancel, you're on that list, then you get docked. So I just, for everybody, I want to clarify that.
Well, just for clarification, Mr. Russell could probably answer this, or one of you. If a deputy's out on the call, he knows he's got an appointment. Hopefully he'll think of it. He may not. Could he call dispatch and ask, and can they call on his behalf and cancel that appointment?
We are
If it's
equal
before 7
opportunity
o'clock.
cancelers. All you got to do is get your name off the list.
So anybody could, so that guy could radio in, say, hey, make a call. And is that, but I mean, if he's on, somebody's at dispatch 24 hours, you know, and so that is acceptable for somebody from dispatch to call on their behalf or something like that.
More discussion? Sonia?
Thinking about their conversation, if we say that they're supposed to call by 7 a.m., if I kind of understand where Mr. Russell's going, they're on a call, their appointment's at 1, they're on a call and it's 12 noon, they're clearly not going to make that 7 a.m. call. Is that still going to be acceptable for them to call as long as they cancel before their appointment?
If they have a 1 o'clock appointment tomorrow, they will have to cancel sometime before 7 a.m. tomorrow morning, or else they will be charged a no-show.
Okay, I think that's what I was wanting to make sure that we all understood that, because, okay.
Well, it's the same thing if you're a clerical person. I'm not trying to downplay because they play a very important role, but we get calls. People say, you know, I was in the class, I had a teacher or I had a parent come in and I couldn't break away. I mean, those things do happen, and I know that, yeah.
Lisa?
I guess I don't have an understanding that Dr. Joe on the corner doesn't make concessions. If he's got a charge of $25 no-show charge, does he make concessions, say, oh, you're a teacher, we're not going to do it. Oh, you're a patrol, we're not going to do it. Do they do? Oh, your doctor does?
Yeah, my doctor does.
I think the problem becomes is who's going to make that decision. I mean, that's the problem. I don't want that job. I will say that publicly. I don't want the one that says I'm not charging Lisa Nola and I'm charging Sonia Stevenson. I will gladly hand that torch to somebody else, but I do understand that life happens and people get caught up in things. I do understand that.
But as usual, we got to start somewhere. So we'll go from here, and more than likely we may get to revisit it next year if commission sees fit. All right, we do have the motion on the floor. Is there any more discussion or questions or comments? All right, hearing none, we'll take a Mr. Joe.
I will. I will do that when the next one's up. No, that's okay. I don't mind doing it. But really, Mr. Russell, I don't think it's people that are getting hung up in their jobs. I just think people are not showing up based on the feedback that I'm getting. So
Maybe start as something as simple as County General, Board of Education, Highway Department, and maybe break County General like Mr. Dan Good does, each department. No names, just such and such for the departments just to see. All right. Any more discussion? All right, we'll go ahead and vote on this motion. All those in favor, please say aye. Aye. All those opposed? All right, motion passes. Ms. Stinson, do you have any other business? We took care of our no-show.
We got one final thing. Open enrollment ends tomorrow at noon. The system locks automatically. We can't unlock it. We have about 35% of all employees that have yet to do it. We have mailed packets to the homes. We're still getting phone calls on I didn't get information. We say, remember the big white envelope with the red stamp that said open enrollment? They say yes. We say that's it. You got to open it, got to get it done by Friday at noon or else you miss the deadline.
All right. Any other business? All right, hearing none, we'll declare the meeting adjourned. Thank you very much.